Now it's my pleasure to introduce one of our underwriters making today possible. Evolent Health CEO Frank Williams is here to share a message from Evolent and to say hello.
Well, it's nice to be here. I have to say I'm always blown away by the agenda at these healthcare conferences because, it spans digital health, the Ebola crisis, genomics, so many different topics, and you realize how much complexity there is to go from an idea to actually putting it in place. And, as the CEO of Evolent Health, we work with provider-based organizations. I'm constantly asked, and if you think about all that you read in the newspaper about changes going on in healthcare, is it really going to happen? I think for a lot of us, we've been talking about digital health for 25 years and risk in the 90s, and yet we didn't see a lot of change in healthcare. So I think if you step back and think about what's going on right now, or at least what we see in the market, some really important trends. First, I think you see incredible frustration with purchasers about value in healthcare. Costs are too high and they're not going to simply pay more and more dollars and get less quality. You see physicians incredibly frustrated, most primary care physicians seeing 30 patients a day. How can you do all of these wonderful things about complex care management if you're seeing 30 patients a day? But then you also see some integrated finance and delivery systems delivering better care. You see advances in clinical IT and innovation, and you see an environment, at least we do out in the field, where providers really want to practice in a very different way. So in many ways, I think it's one of the most exciting times to be in healthcare. I was just in Indiana last week with IU Health, which is a $4 billion health system that we work with. Right now, they have over 100,000 lives in what would be called value-based care arrangements, some of them fully capitated, some of them government-based programs. And what they've done that's so different than what you see in a lot of environments where we talk about value is they've really worked to engage the physicians in change. And I think this is one of the most important themes for the conference. It's great to have a wonderful idea, but if physicians aren't bought in, it's very hard to get adoption across the marketplace. We're actually there providing infrastructure technology. If you think about managing a population, you need to know everything you can about that population to manage them effectively. So when we talk about big data and infrastructure, it's pretty critical that you put those things in place to support the physician. And then if you think about 30 patients per day, you ask the average physician, they probably didn't need to see half those patients. So how do you build integrated care teams around the physician so that the patients they didn't need to see can be supported in other ways and much more broadly than they are today in primary care? And what we're seeing in Indiana are stunning patient engagement rates. And it's not a nurse from a health insurance plan calling them at home. It's someone from their doctor's office engaging them in their health, and when your doctor calls, you pick up the phone. So the how actually really matters in terms of how we deliver higher quality care and lower cost. So from our work, we really believe that you ultimately enhance patient engagement by enhancing physician engagement. And if you think about physicians, so many times a binder is dropped on their desk and they're told, this is what you have to do, versus here's the problem, here's the data, how do you ultimately help us solve it? And so if you think about engaging physicians, putting in place integrated care teams, having sophisticated data infrastructure, marrying the clinical and financial, I think that's one of the biggest things. If the incentives aren't there to manage a population effectively, the doctor's not rewarded for the right behavior, you're not going to see behavior change. And then you need to have enough infrastructure. If you think about a patient traveling across the continuum, incredibly complex to manage them, through their episode, through physical therapy, through home care, et cetera. So you need to have the right infrastructure to do that. So Evolent, interestingly enough, started about 3.5 years ago to essentially be that interface. People, process, and technology. How do you take innovation and actually really drive it into the delivery system? And it's very hard, and people don't want to change, and a lot of hard gravel road stuff that we do on a day-to-day basis. But today, 800 people, we've raised $100 million in capital. We're working in about 25 markets where we see really delivery system change. And the results are there. A lot of people are asking, can you deliver better results? At MedStar locally, we've taken their employee trend, was at 8% a year, to negative. So actually reducing the cost year over year. Vanderbilt, we're building a multi-state network, again, led by high-quality care at Vanderbilt, but really bringing providers together in a different model. So for those of you who may be a little bit cynical, it's been easy to step back and say change is really not going to happen in healthcare. I'll tell you that what we're seeing are really, really positive results, and it's early, but we're pretty optimistic about what's going on in the marketplace. So great to be here. It's wonderful to see some of the innovative companies that are presenting, and I think is for any of you that are trying to drive innovation in healthcare, I think what I would ask of you is think through how does that innovation actually get driven into our care system. How do physicians adopt it? Why would they use it? How are they going to effectively leverage data from wearables or other things into their practice? And how do we essentially drive incentives that will more effectively engage the patients? Because that's ultimately where it's won and lost. If we're not engaging patients effectively, 5% of the patients are costing 50% of the dollars, we're really not going to have an impact on cost or quality. So we have to think through how those things fit into our care model. So wonderful to be here. Wonderful to support this kind of event, and I'll look forward to working with many of you across the coming year. Thanks.